Asthma is not contagious. It is not a disease that can be transmitted from person to person like a cold or flu. Asthma is a chronic condition characterized by inflammation and narrowing of the airways, which makes it difficult for air to flow in and out of the lungs. It is primarily caused by a combination of genetic and environmental factors. Common symptoms of asthma include wheezing, a whistling sound when breathing, especially during exhaling; coughing, often worse at night or early in the morning; shortness of breath, difficulty breathing or feeling out of breath; chest tightness, a sensation of pressure or squeezing in the chest. These symptoms can range from mild to severe and can vary from person to person. Some individuals may experience asthma symptoms only during certain triggers or exacerbations, while others may have persistent symptoms. The exact causes of asthma are not fully understood, but several factors contribute to its development. Asthma tends to run in families, suggesting a genetic predisposition. Certain gene variations are associated with an increased risk of developing asthma. Exposure to certain environmental triggers can provoke or worsen asthma symptoms. These triggers can include allergens, such as pollen, dust mites, and pet dander, air pollution, respiratory infections, cigarette smoke, and irritants like strong odors or chemicals. In some cases, asthma may be triggered by an allergic response to specific substances or allergens. Airway hyperresponsiveness. People with asthma have airways that are more sensitive to various triggers, causing them to react and narrow more easily. It's important to note that while asthma cannot be cured, it can be effectively managed with appropriate treatment and lifestyle modifications. If you or someone you know is experiencing symptoms suggestive of asthma, it is recommended to consult a healthcare professional for proper evaluation, diagnosis, and management. While there is currently no known cure for asthma, there are several ways to prevent asthma attacks and effectively manage the condition. Here are some strategies that can help. Identify and avoid triggers. Determine the specific triggers that worsen your asthma symptoms and try to minimize your exposure to them. Common triggers include allergens, pollen, dust mites, pet dander, air pollution, tobacco smoke, respiratory infections, and certain medications. Avoiding triggers can significantly reduce the frequency and severity of asthma attacks. Create an asthma action plan. Work with your healthcare provider to develop a personalized asthma action plan. This plan will outline your daily management strategies, medications, and steps to take during an asthma attack. It helps you monitor and control your symptoms effectively. Take medications as prescribed. Depending on the severity of your asthma, your doctor may prescribe various medications, including inhalers, bronchodilators, corticosteroids, to relieve symptoms and prevent inflammation. It's crucial to take these medications as prescribed and follow the recommended dosage and schedule. Practice good inhaler technique. Learn and practice proper inhaler techniques to ensure that you are getting the maximum benefit from your medications. Improper technique may result in inadequate drug delivery to your lungs. Maintain a healthy lifestyle. Follow a healthy lifestyle that includes regular exercise, a balanced diet, adequate sleep, and stress management. Regular physical activity, such as aerobic exercises, can improve lung function and overall respiratory health. Keep your environment clean. Create a clean and allergen-free environment by regularly cleaning your living space, minimizing dust, and using allergen-proof covers on pillows and mattresses. Proper ventilation and air filtration systems can also help reduce exposure to airborne allergens and pollutants. Stay up to date with vaccinations. Respiratory infections can trigger asthma attacks, so it's important to stay up to date with vaccinations, including the annual flu shot and pneumococcal vaccines. Schedule regular checkups with your healthcare provider to monitor your asthma, adjust your treatment plan if necessary, and ensure that your condition is well managed. Remember, asthma management should be personalized, and it's important to work closely with your healthcare provider to develop an individualized approach based on your specific needs and circumstances.